Anabolic steroids. For some, they're the secret weapon to explosive muscle growth. For others, they're a dangerous shortcut with severe health risks. But what does science really say? In this video, we'll dive deep into the evidence, the proven benefits, the medical applications, and the very real risks. Let's separate myths from facts. In 1996, a famous study published in the New England Journal of Medicine by Bhasin and colleagues finally gave us solid answers. They studied 43 healthy men, dividing them into different groups: testosterone with training, testosterone without training, and placebo. After just 10 weeks, the results were striking. The placebo group gained about 2 kilos of lean mass. Testosterone alone added 3.2 kilos. But when combined with training, the gain reached over 6 kilos of lean muscle. This means steroids work even without exercise. But when paired with resistance training, the effect is literally doubled. Science confirms anabolic steroids do increase muscle mass significantly. But steroids are not only used in gyms. In medicine, they can actually save lives. One example comes from Porro and colleagues who studied oxandrolone in over 200 burn patients with more than 30% of their bodies severely injured. Results showed that patients preserved more muscle mass, lost less weight, and recovered faster compared to placebo. Another study led by Sheffield-Moore in 2006 tested testosterone in elderly men with sarcopenia, a condition of severe muscle loss. After 6 months, patients had gained an average of 2.7 kilos of lean mass. These studies show us something important. Anabolic steroids have legitimate clinical use when prescribed and monitored by doctors. They are not only about aesthetics, but about survival and health. However, the other side of the story is serious. A clinical review by Kopera in 1993 described several well-documented risks. Steroids can suppress the body's natural testosterone production, leading to infertility and testicular shrinkage. They can also cause gynecomastia, or breast growth in men, due to estrogen conversion. Other risks include elevated hematocrit levels, which increase the chance of blood clots and heart problems, liver damage, especially with oral steroids, and psychological effects such as irritability or dependence. A 2008 study by Kanayama and colleagues in recreational bodybuilders also reported that many users faced fertility problems and withdrawal symptoms once they stopped using steroids. The science is clear. The risks are not just theory, they happen in real life. Nandrolone, popularly known as DECA, is one of the most famous anabolic steroids. Clinically, it has been used in osteoporosis and muscle-wasting diseases. Some users even report improved joint pain as a side effect. But the same drug can also alter blood lipids, raising bad cholesterol and increasing cardiovascular risks. So even with apparent benefits, there's always a cost. A less visible but equally important effect is on mental health. A 2014 review by Pope and colleagues concluded that chronic users may develop dependence, irritability, and even depression during withdrawal. Of course, not everyone reacts the same way. Individual vulnerability matters, but the possibility of psychological consequences is real and scientifically documented. So let's summarize. On the one hand, steroids increase muscle mass and strength, protect against muscle loss and severe diseases, accelerate recovery in burn patients, and may even help combat sarcopenia in the elderly. On the other hand, they suppress natural hormones, affect the heart and liver, alter mood, and can lead to dependence and withdrawal. The same substance that is medicine in hospitals can turn into a dangerous risk in gyms. Anabolic steroids work. That's not a debate. The real question is, at what cost? Used under strict medical supervision, they can save lives. But recreational use without guidance can lead to consequences that last a lifetime. Science leaves no doubt. Benefits exist, but risks are just as real. So before chasing shortcuts, remember, your health is not replaceable. Always put knowledge above impulse. Want a chance to win $500? Just subscribe to the channel, comment on this video, and share it with 2 people. Then take a screenshot and send it to our Instagram. Link in the description. If you're already participating through previous videos, make sure to comment and share this one too. That way you'll increase your chances of winning. The giveaway will take place on December 5th.